I wanted to discuss something.
Yes.
And just looking back at several things that have happened. Okay? So we know that, and we've just been told by the Chief Conservator of Forests.
Right.
2023, late 2023, the government issues a directive that all payments go through one portal, the e-citizen portal. Okay? And they're told within a year, and they take, no, within a month, and they take long to roll it out. We also know that around October 2023, the government starts rolling out the Social Health Authority, universal health coverage. And, you know, it started in slowly. Now we are converting from NHIF to SHA. We have seen the progress of that. 1st of July this year, the government rolled out the EGP, that's the e-procurement portal, where all public procurement processes now ending the previous model, where entities procured goods and services independently and without central visibility. Now, all procurement is through the EGP portal, where everybody can see what you're procuring. Whether you're a small entity in government, like the Kenya Forest Service, and by small here I mean small in terms of influence, whether you're a big entity like the National Treasury and you're procuring, or the Ministry of Roads and Infrastructure and you're procuring, all of them will be visible, okay?
Yeah.
Now, what have we seen? We've seen the rollout of e-citizen and with various entities where people would go, for example, to the national parks and find long queues. Why? Because tunajaribu kuingia kwa e-citizen platform, they're having issues. Officers manning the park gates don't seem to be completely sure of how to navigate through this system to get you in.
Been there.
People have come in and they're told, you could have just logged onto e-citizen Kitambo. By the time you get here, you'll have paid. You did not know that you needed to do that, okay? That's on e-citizen. Now we are seeing even on Karura, okay? SHA. We saw what happened with the rollout of SHA. So we've started SHA and, you know, go to a facility, you're told, umeregister SHA. Sija register kwanza, ndio uweze kupata matibabu hapa. People just not aware. Facilities, some of them not aware of what they're supposed to do.
Right.
We are seeing it now again with e-procurement with government.
Yeah.
The Cabinet Secretary for the National Treasury, John Buddy, has been screaming himself hoarse recently, calling out everybody a saboteur and saying you're all just sabotaging this process. You do not want to implement it, and this is the only way to go. Yesterday, it was the Council of Governors, led by their chair, FCPA, Ahmed Abdullahi, and their vice chair, the governor of Nyeri, Molimo Mutai Kahiga. They were raising issue about this e-procurement portal. And in fact, FCPA Ahmed Abdullahi was saying, show me one entity where this EGP has worked. I will send the staff from the Council of Governors plus my own Wajir County to come and see it. So that then we can benchmark and see it working. Okay? It raises the issues on how government rolls out its projects. And every time government is questioned about how you rolled out a project, you call out saboteurs. You say these are people who are the corrupt elements fighting back. They did not want to roll it out. You do not want to hear questions about maybe we did not communicate well. Maybe we had not tried this thing out, and so we don't know the capacity of it to handle the volumes that we have. Maybe we hadn't thought through end to end. You don't want to hear any of that. All you're seeing is saboteurs of saboteurs all over. Mashetani wameingilia, majini. And I want to say, government calling everything sabotage, miss me with that.
Thank you. Nailed it. Right on the head. Because the examples are so many. Just by flipping through today's Daily Nation, you will see about 5 different examples of exactly that. Poorly communicated things rolled out in a hurry or rolled out without stakeholder engagement, and then panic when things go wrong, and then calls of either saboteurs or corruption, whatever it is, the names can differ. You're absolutely right. Looking through Governors Defy Ruto on e-procurement, perfect last example you've given. You take the next page of the Daily Nation, page 7. Schools send students home as state withholds capitation. One of the issues that came from this was that NEMIS, it's NEMIS, right? Yes. Does not have For example, capitation being sent.
Yes,
all data of all students, because some don't have birth certificates. Some do. I'm like, okay. So now there's learners not receiving capitation, not because they're not learners, because they're not on NEMIS. Why? Because they don't have a birth certificate. And the law requires that every student receiving capitation be on NEMIS. It's a disservice to those students. Again, it's coming from a great place where we can verify who is student Eric Latiff, where does he study, and has that institution received capitation funds for him? That's the intention. In reality, it is student Latiff does not receive capitation because
he's not in the system.
He's not in the system.
Why is he not in the system? Who knows? Sijui mara no birth certificate, mara not registered. Like, who knows?
Who knows?
Yeah.
Again, page 7 of the Daily Nation. Duale hands over 1,188 files on fraudulent facilities to the DCI. SHA, I mean, the whole social health insurance fund, what do we call it? The whole umbrella network?
Universal health coverage.
Yes, universal health coverage. One of its components is the Digital Health Act.
Yes.
Of that, the idea is again meant to be accountability.
Yes.
It's meant to be facility X exists.
Yes.
It is a level 2.
These are the staff working at that facility.
Right.
All the way from doctor to the lowest assistant.
Clinician to nurse to, yes.
Yeah.
Okay, this is how much this facility received last month, last year, in the last 10 years. But in just a year of SHA, 10.6 billion.
Almost went. This is the one that almost...
Almost went. From just a cursory overview of the kinds of facilities that we have seen being exposed, right? The dispensary that is somehow receiving millions of shillings, and you're looking at that building, squinting hard as you can, trying to see where millions of shillings could go in such a facility, to the places where Nivumbi too, there's nothing, quite literally nothing. Those are, again, incidences where the intention is fantastic, the rollout has been rushed, and as a result, there's loopholes that are either benefiting private individuals or taking away from the citizens that require these services. So you're right, blaming saboteurs when you're the one who has decided not to do this thing correctly, to roll it out, to communicate, to test it, to pilot it, is absolutely, yeah, it missed me with that. And I think we spoke specifically about the initial plan for what universal health coverage was meant to look like. This was meant to be a 4-year rollout that was then done in 3 months.
They don't even know how much they've done. It wasn't clear whether it's a 3-month rollout, a 6-month rollout, a 1-year rollout, a 4-year rollout. At what point, what are the milestones?
I think this was specifically for the digital...
It was the Digital Health Agency to have all this within 4 years.
Yes.
But what are the milestones within those 4 years, right? And how well communicated are they? So, for example, if we just to look back at how else could you have done it, right?
Yeah.
How else could you have rolled out the universal health coverage in the country? So you have the laws, and we had an MP the other day saying they were burning the midnight oil to give Ruto his laws. So, okay, let's just say that they gave Ruto his laws. One of the members of that committee is an MP called Kibagendi, who keeps saying that this SHA is a mistake. They processed the laws in the health committee, and they passed the laws in the health committee. Okay?
Yeah.
Now
and
they
he
say
says
it's a
there's
mistake.
a mistake. Yeah.
All right. But once those laws were passed and the president signed this thing into law, and on that day, that Mashujaa day that then happened, was it in Kericho, that he says, now we are rolling out universal health coverage. In fact, on that Mashujaa day, the president said, we are rolling out universal health coverage come January. Which was obviously...
Mashujaa day.
Come Jan, okay?
Okay.
Yes, okay. But then the law said that there would be a year to phase out NHIF and to bring in the Social Health Authority. And that NHIF would then hand over its assets and liabilities to the Social Health Authority. They had a year to do this. They also had a year to establish the kind of data management system that existed in the entire health ecosystem from the Ministry of Health to counties and amalgamating it into the Digital Health Agency. They had time to do it. They had time to go through all the facilities in Kenya, because now every facility counts, and now the law says that we are mapping, every 100 households into a facility and so on and so forth. They had time to actually do that, conduct a census of all facilities, and look at their readiness to roll out this service. Private, public, faith-based. Go and see this particular facility, the kind of facility it is, the equipment it has, the staff it has. It's a level 2, it's a level 3, it's a level 4, 5, 6, and so on. And assign it its proper level. They had time to do this. They had time to look at each of these 100 households and map them to a CHP. They had time.
They did.
They had time then to start communicating to the people and saying, from this point, now we are changing. If you fall sick, before you go to
Kenyatta,
we know to Kenyatta, or the others that we call PGHs, the former provincial general hospital.
Yes.
Before you go to PGH or you go to Kenyatta, first go to dispensary. Then you go to health center. Then you shall go to the sub-county, level 4, and so on and so forth. They had time to communicate that. That also say there will be a new registration into a new facility, into a new platform.
Right.
We need you to register into SHA. And this is why. There's time. They had time. A whole year. That come October 2024, they're like, okay, now we are rolling out SHA. We are doing 1 month of just pre-trial, and then November, we are going full on with SHA. And we saw what happened. Facilities claiming we have not been paid by NHIF. You have not been paid. Why? The NHIF owed us money. How did NHIF owe you money? No, the government owed NHIF money. Guy, the government. Surprise.
Shock and awe.
How many facilities do we have?
Yeah.
Now we are actually mapping the facilities now to see which facilities now have the capacity. This is after they've said we have rolled out.
Yes.
And then they come and tell us about fraud, about facilities, about people fighting, about people pushing back, about people doing all these things. It's because of a poor management of the rollout. It's clear as day can be.
Could I even take you a little bit back? It's not just poor rollout. I feel like I'm sitting here and then I'm thinking like Jano, because I can see how she would thread this. It's not just poor rollout. I think to me it's the intention with which the things are being done. And the fact that there is no piloting or trisecs or, attempts to figure out what's working, what's not, tells me then the expediency is not for the sake of progress. It's political expediency. It's not because we really want universal healthcare across the country. We want every Kenyan to be covered under SHA. No, this is my big thing.
It's political bonga points.
Yes, it's my administration's big thing. Universal health coverage. So whether we
I'm the one who got it done.
Right.
The other guys were just wasting time with their handshake things.
Boom.
They didn't get it done.
So whether we kiss me or windekni, we must be seen to be doing. So we must roll out SHA. Where is the pilot of SHA that you decided, I'm going to try roll it out? Makueni has had a similar system on its own as a county. This would be a great place to start a rollout and to pilot and to learn from, figure out how this looks. Okay, this is what they've been doing. This is what we have envisioned for universal healthcare coverage in the country. Let's integrate systems. Let's see what's working. Let's not. Okay, fine. We are 2 years into this. I think we've figured out how to roll it countrywide. Fantastic. We're going with it now. We want to change the funding model. Okay. We've realized that we are covering the same cost for every student, but not every student has the same level of need. There's an issue there. Fantastic. Okay. Let's create a means testing instrument to determine how much you should give student Mariam and student Latiff, right?
Yeah.
Okay. Where do we then say, let me go to the University of Nairobi, not even the entire, let me start with the School of Economics and just roll out there. And I just do a pilot for just 1 year, right?
Yep.
And I ask student Latiff, so what do your parents do for a living? They're civil servants. Band 5, you sound wealthy. Student Mariam, what do your parents do for a living? They're just informal, Juakali. I am band 1. Turns out she meant their own business. Yep. And student Latiff, his parents have not been active civil servants for 5 years.
Oh, they're civil servants, yes, but
they're not,
junior
they're not high-earning civil servants.
Yeah.
Now, Mariam is in band 1 and you're in band 5.
Yep.
Then they realize, Mariam and Latiff go and they say, you guys, you've placed us in the wrong bands. And then they fix that and then they roll out. If there was intention, if there was actual intention of fixing these problems, there would be more intentionality in how it's being done. It wouldn't be as haphazard, it wouldn't be as quick, it wouldn't be as poorly communicated. Yeah, I think that is the biggest red flag for me. And you're right, crying wolf, saying saboteurs here, there, it's just an attempt to deflect the responsibility from what you should have done, which was all the things we've said.
It's just failure. That's it. Failure. Failure. That's basically it. Because, like you're saying, it's for expediency's sake and not for the sake of seeing it roll out. That example that you've given, very good example of the university funding model, okay? So we have a situation here where universities are collapsing in debt because not able to raise money. One of the key reasons why they are collapsing in debt and not able to raise money is because the government is not meeting its end of the bargain in the differentiated unit cost, where the government should have been sending over 60% of a cost training per student to that student.
Right.
The government is not able to meet its end of the bargain. So the government has not been sending the money that it should have been sending. It's sending less than 40% when it should be sending 80%, right? Universities, debt.
Right.
So how do we address this issue? Let's now bring in 3 bands. So university, student, household, student loan, and then government sponsorship, okay? Knowing full well that government has not been meeting its end of the bargain, but you're not addressing this particular issue here, you're bringing the others.
Yeah.
And like you've said, knowing full well that the former means testing instrument, because it was just giving student loans, people did not have issues with it because they were receiving loans.
Yeah.
And it was just an amount, the rest of the amount was
standard.
What was coming from government. 80% of the money was to come from government.
And the rest will come
from HELB.
from HELB.
Just come from HELB.
And you're good to go.
Sort it.
Yeah.
So people are not really raising issues, but there were issues with the means testing instrument being rolled out by HELB even then. Now go back, and the people running HELB and the university fund knew it. Instead of working on that MTI, like you've said, roll it out. It raises hue and cry. Form a task force of 150 people to address that one problem. Still, you have not addressed it. And now you'll come back and say, but you see, this is the best thing.
Right.
These are just rich people who do not want to pay because they don't want to pay to support the poor people. It's the rich people who don't want to pay to support the poor people, and so on and so forth. Argue and argue. Same with the e-procurement portal. How much communication happened? How many sessions, for example, did the National Treasury have with the Council of Governors and say, let's pick 5 of the 47 counties and go in there and use them as models. You are using EGP from procurement A to Z. County A, these are the challenges you're facing. These are the all right, so let's address that. County B, are your challenges similar to County A? So these are the solutions we came up with. Let's try them here. They are working. Some of these challenges are unique to you. Let's sort out those. And then say, we have these examples. Let's roll it out to the rest of the 47. But now, no, these are people, we know what governors have been doing with money. Now we've caught them red-handed with the hands in the cookie jar. And now they are screaming because we caught them with the hand in the cookie jar. They should follow this thing.
Right.
There's no turning back. The reverse gear cannot be engaged. It's broken. Come on. Really? I mean, what's just so hard about doing things the right way? Why do we find it so difficult to do things the right way? Nobody's going to penalize you for doing things the right way. You still have time. You can still get the bonga points.
You know, I'd actually forgotten about affordable housing. That's how many things we have. That's how many balls we're juggling in the air.
Yeah.
That affordable housing, something as big as affordable housing, could go over my head. I think the thing that comes to mind for me is that epic press conference of PS Hinga attempting to explain affordable housing. And us realizing in real time that perhaps even the people entrusted with it do not understand it.
Yeah.
To this day, Eric, I'm still struggling. I know a little bit more every time we discuss it, but I still struggle with understanding affordable housing.
Yeah.
And I don't think it's accidental. It's not that complex a thing. I don't think I'm particularly dense. I think it's intentional. And I think a lot of these rushed rollouts are also intentional, because those loopholes are where people make their monies. Those loopholes are where people, take advantage of a bad system.
They know that by not rolling it out properly, there'll be a lot of confusion, and you thrive in the chaos at the beginning before the things settle. Okay? And I mean, that's always been like a government thing. There will be teething problems, we call it. There's nothing like teething problems. Okay? When a baby is born, people know that this baby, there are milestones. At this particular point, the child will start teething. Now, the child cries because the teeth are coming out. It was expected. The child is crying because of the discomfort of the teeth growing.
Yeah.
What we call teething problems in government is not we have hit a milestone and now the teeth are growing as part of, and that's why we are feeling the pain. No. No. You have taken a child and you've started using pliers to try and pull the teeth out.
I think so.
And then you call it teething problems. Actually, no, that
you're trying to go into the gum and get teeth out that are not ready to come out. You're absolutely right. When I think of the fixes for this, I tried to think of best case scenario, what some of these things would look like, and thread it through. E-procurement, where do we start? E-procurement is a great place. Okay, governors have said, show me one place where it's working. Charles Ndungu also says, what's one project that the current government can say it has come up with and it's working at 50%? To me, none, which is basically what Governor Abdullahi was saying. So what's a best case scenario? We want to move to e-procurement for the sake of accountability. I want to know down to the procurement of tissue paper in the Kenya Forest Service. Who got that tender and for how much? Fantastic.
And how much it's costing
yes,
per roll of tissue.
Per roll of tissue. I want to know. But what's the way to do it?
First of all, make sure that the people who are in charge of procurement in that entity know. And then let them inform everybody that this is a new system and that's how it's going. Let them call in their stakeholders of suppliers. They have a pool of pre-qualified suppliers. Call them into a workshop and tell them this is what's going to happen. Not from tomorrow, not from next week, but it's going to happen in the next 3 months, okay?
Right.
And let's say, so what we are going to do is the, daily procurements that are, a bit of an issue here. For example, let's say it's an entity that is procuring some items at high volume. Let's not touch those ones because if we disrupt this, then we are affected on a daily basis.
Okay.
So let's start with a few of the items that are not highly critical elements. We are going to test those ones on the portal.
So we don't do Camry procurement immediately. We start with chai,
I'm
tissue.
even saying we're going to KFS.
Oh,
right?
Sorry, yeah.
And this is procurement for KFS. I don't know what KFS buys on a regular basis. Maybe they buy foodstuff, maybe they buy and then once in a while they will buy jembes, okay? And slashers. All right. So we have slashers in store. We are due to start replacing our slashers. So let's test it with item slashers. Put it on the e-procurement portal, EGP. Invite bids. see how the bids are coming, handle the bids, see are there issues that are emerging out of this. Okay, so this one has been successfully done. Now, next one, let's do 3 items. Panga, jembe, helmet. We've seen it's worked, gone. Now, so like that. But don't just wake up and say, from July by the way, kitu yote tunajua tunaenda kwa poto. Kitu gani? Yote.
Yote. The number of services that were onboarded on eCitizen at a go still blows my mind. 15,000 services is crazy. I think through it and I'm like, the fact that it did not crash is probably a miracle. Anyway, it's work and hard work on the part of many people.
Yeah.
But there's no reason why you should be onboarding 15,000 at once when you have the option to stagger. Okay.
But remember also in that onboarding, there are very many of them that were those that you do not need, you're not doing on a daily and a regular. So
That's
they
true.
bring those ones on board, let them sit there, let's see how it's rolling out, bring others on board and so on and so forth, right? So it's the same. It's how do you start something like this? Or if you've been testing it for a long time, like the eCitizen, if they'd been testing it, the platform is ready.
Yeah.
We've just been waiting for the agencies to bring their services
on board. Okay.
Then agencies, platform has been waiting for you. Put the services there. Let's go. But at the same time, communicate with everybody.
Yeah.
That now you log on to eCitizen, you create your account, you have a PIN, and then you log in there, and then from there you navigate to the specific service you're looking for, and this is what you shall do, and
so on and so forth. Okay, put yourself, because the problem solving we're doing or attempting to do is some of like the conversations that should have been had beforehand. Okay, there's a Karura forest in existence. It is managed by a joint management committee of the Kenya Forest Service and the Friends of Karura. A government directive says all payments now go through 222. The PFM Act says it has to be an account, all public monies must go into accounts that can be audited by the Auditor General.
Yes.
So it can't, and that we can't audit Friends of Karura.
Yeah.
Gava doesn't know who that is.
Yeah.
What is the way forward?
On that one, Simbo, this meeting that they say that they had on the 30th of June,
Yes.
right, where a report has been brought. So here are issues. Guys, we are in contravention of the law, and we need to do something around it. So what is it? It's not about where the money goes, it's what the money does, okay? So we have the joint management decides what we do with the money and how we conserve the forest. What do we have? We have salaries, we have casuals, we have projects, we have, we are doing lights, we are doing the fence.
We're buying seeds.
We have all those things. These are the things that we do with the money on a regular basis. So let's address how shall we be getting this money here. Okay? Now, look at our agreement. What does our agreement say? It says this and the other. How can we make this agreement work for us? Do we need to amend an item here? Do we need to amend an item there? Do we need to do this and the other? Okay. Because this agreement is recognized in law. We have a Forest Management Act that allows for a co-management of forest to the community involvement. Then it's legal. So we'll not be breaking any law when the Chief Conservator of Forests signs off X amount of money to do these things that it's doing. It does not have to leave here, go to an account that is jointly managed for it to come. It just can only be that these are the requests,
right?
They are presented, and the services are done. So we can start with that and
cut out the middleman.
Cut out, because taking the money from here into that account may be the issue that the Auditor General will be coming to raise and say, why is money leaving government account and going to a private account to do things? Right. But if it's this KFS that's paying directly, Chief Conservator is paying staff of Friends of Karura as per the agreement. Chief Conservator is buying diesel. Chief Conservator is doing this and the other. Then So they could have agreed on those things and see how do we work on this?
Yeah.
How do we work it out? All right. Are there other ways in which you raise money? So as Friends of Karura, you have friends, you have people who would like to donate directly.
Partners.
Partners and so on and so forth. What do we do around that? Can we include a clause here that then says what we do around that?
Right.
Because that's not then, that we can say that is not government money.
Yeah.
Right?
No, that is not it's not a park fee, a forest fee.
Yeah.
That's it.
Yeah, it's a well-wisher.
Yeah, it's a well-wisher.
Wanting to support government, and there's nothing in government revenues called well-wisher.
Okay. I'm thinking through, this is Adrian saying KE Treasury delays to release capitation this week, and many occurrences, including full amounts, indicates to me rogue elements or gross incompetence in the creature of government called Treasury. Now, this now goes back to the schools. Why have they withheld funds this time? Delays are part of the usual, which is still part of the system and the problems there we're in. This particular delay is because we're now auditing schools and learners, actually, down to the learner, not down to the school. Again, this is coming, it's reactionary. The two things always come from two places. Everything is rolled out either for political expediency, so it's done rushed, fast, haraka haraka, twende, tumalize, so that this can be my big project, and you give me a thumbs up. Number two, when things go wrong after the rushed rollout, it's now reactionary. The reaction here being the Daily Nation and all other newspapers and all other TV stations have been carrying stories of ghost schools, ghost learners, right? The famous gate with just ndio shule, the gate. Fine. So what do? We audit. We audit learners, we audit schools. Fantastic. When do we do that? At the time when we're supposed to be releasing capitation. Who suffers? The learner who is no longer able to stay in school now because there are no funds in the account for them.
Yeah.
Who thinks through these things? At some point you have to ask yourself, what is the thought process, if any?
I think sometimes I look back and I go back and we can invite people to even call in and give their views on this. I mean, what's ailing us and how do we fix this? What's ailing us and how do we fix it? I look back sometimes and I see the structure of government that we have and structure of governance that we have is somehow also playing a big role here.
Okay.
In that we come from a point of policing, that in everything it is kifua by force, it's by order. It's implement or go home.
Right.
It's and if you're not implementing, I'll fire you, I'll jail you, I'll punish you, I'll transfer you, or I'll call you a thief.
You won't get services.
So that is the way. It's kifua. Government comes to you with kifua. Toka hapa. Tumefunga barabara. Sasa mimi nilikuwa naenda Thika, enda huko utafute njia ya Thika. Si uniambie tu mimi sijui huko, mimi nataka enda hivyo utafute barabara ya Thika.
Right. So you hojeka signs.
Yes.
From nikiwa Globe, there was no sign telling me.
Tumefunga barabara. Si mimi nakwambia tumefunga barabara.
There was no sign telling me nikifika Globe that
walitangaza jana. You know?
Yeah.
Pita hivyo. You go to a government office and you are seeking a certain service and you needed a certain document and you don't have that document. And uko na hii. Sasa kama hiyo huna unataka nifanyaje? Nikusaidia aje sasa? It's I'm looking for a mistake that you've made, so that I can capitalize on that and tell you this is the reason why I cannot serve you.
Yep.
Sasa umekuja na hizo zote na hujakuja na hiyo. Nifanya nini?
Form ulikuwa unafaa kuandika in caps. Now I have to go start the line.
Umepitia counter 5. Where's kuja hapa kama unaenda counter 5? That's just how we are wired in our government.
Yes,
that's
policing.
Policing. So there's a directive, let's go to 22222. All right? you come in now, you are the implementer. Instead of now coming and calling your team and asking them, so guys, how do we migrate to 2.2.2.2 smoothly?
Right.
If you come in and say, it's a directive. You're passing it down as a directive. It's command. Command says 2.2.2.2. I pass on the command 2.2.2.2. Everybody. There's no conversation around how do we do it best. Who is likely to get impacted?
Right.
How do we, mitigate those kind of issues? There's nothing like that.
Yeah.
Imetoka juu. Now, if you happen to be somebody who is seeking service, and you meet with Officer 7 down the rank and tells you, you can't ask them a question. Because they'll be rude to you because they don't have an answer.
Yeah.
And they can't tell you, I don't have an answer. You're in a directive.
And that's exactly where we are right now. You've spoken, I think you've put it very well. So the problem is that the fix for me, simple as it seems, Article 1, all sovereign power belongs to the people. There is no people-centered approach in the way we do things. If you think people first, none of these problems would exist. If you think end user, none of these would exist. If you think about the end user of a park or a forest being the person who wants to come and walk in Karura on a Sunday morning or on a Monday morning, if you think about that person, then you don't just say 22222, because then you'll realize, Karura, it's not just KFS, there's another partner. Okay, that's not a government State Department, it's not anything government. So then, how do I now bring them into the fold? They're managing Karura. They're part of this joint management committee that's collecting fees for Karura. Okay, how do I bring them in? Oh, fantastic.
Yeah.
The minute you ask that question, you're already halfway there. You need capitation to go to schools. The minute you're thinking about the learner, you're thinking about their education and the quality of education. You're thinking about consistency and sustainability, and you're thinking about also the quality. Then you start asking yourself, I have 3 terms in a year. This is how much I have this year. This is how much I need to give by this date, every start of the term, to make sure that these learners are in school. Okay. Then you work backwards from there. And you say, Sawa, how many of these learners are there? Okay. NEMIS has how many? Okay. But there's some that haven't been captured on NEMIS. What's the issue there? The minute you start from people and work your way backwards, I think you've solved so many, like 98% of these problems. You have a new social health authority. Fantastic. You want to give universal health coverage. Fantastic. You're thinking of the user, who is the person who will be going there. Then it means that you don't cap their monies on like a flat rate basis. If it's a cancer patient, you don't just give a flat out number of 500,000 or this, because you understand that some can cost 20, 30,000 to treat. Some can cost millions to treat. If you're people-centered, then you work backwards from there.
Yes.
As opposed to saying, this is how much we cover, and that is the amount. Ukifika 450 sasa, you anza kufikiria kwingine. Aya. Same thing, every single thing. If it was really people-centered or it was meant to work for people, you would not be having these issues. But the idea of these big rollouts is political expediency. That's why people come second. It's like the user experience is secondary to let's roll it out so that we can say we have built these many affordable houses, we have launched this, we have a new universal health coverage system, we have a new funding model, we have a new capitation Good Lord. Yeah.
Adrian says, Kenya is a country of shareholders, not stakeholders. It has never changed since the 1920s. And then Charles is saying, we don't have a public service, we have public goonism. So it's not about serving the public. It's not about, interest of the public first. It's just, it's goonism.
Goonism is such an interesting word.
Yeah.
When you think about the fixes, I'm thinking people-centered, genuinely. start with the person who you are serving.
Yes.
Not your own goals. That's number one for me. Number two, it's accountability. And I think that one goes back to najua shida yako penye inakuanga, which road and which building specifically. But I don't know how easy sasa. Realistically, how does that house on Parliament Road help with these issues? Capitation, SHA, e-procurement, zote.
You know, the way it's even structured, our parliament is structured in a way that really, if those men and women there just decided to do their job, they could do it very well. Committees. Committees are supposed to help them with the oversight role, okay? So where, for example, the health committee, after you processed those laws and you took the report to Parliament and Parliament passed the 4 laws and you're supposed to roll out, one of the things that the health committee then should have done, together with the committee on implementation, would have been look at the milestones and make sure that you're tracking those milestones. So the health committee should have been summoning the Ministry of Health and the NHIF to come and say, NHIF, how are you preparing for your death? Because you're dying. According to the law, you're dying in October 2024. How are you preparing for your death? Have you put all your affairs in order? Is there a list of all your assets, and all your liabilities, all your staff and what they do, and your payroll? Is that all in order? Ministry, can you confirm? At what point do we establish the new Social Health Authority? So it starts working with NHIF for transition. How is the transition going? Ministry, can you confirm that this transition is meeting the milestones that we've set in this implementation plan? That's the job that the Health Committee could have been doing in that entire year, to see that this thing is done properly. So that even if there are thugs and incompetent nincompoop in the Ministry of Health, and the former NHIF, there'd be somebody who can see through them.
Eric, you're the same person who said, with these committees, it's a...
That's why I said...
But where's the bite?
If we had men and women who at least wanted to do their job, at least, you know, they tried to just do their job, they would have done it. They would have done it.
Where's the bite?
How much money we are getting into... coming up into a new budget now in July. We are rolling out SHA in the new financial year in September, October. How much money are we setting aside for that?
That rollout.
Primary health care will need to be funded. The critical illness, chronic illness, critical care fund will need to be funded. How much money is going into this? Is that enough? Let us see. Does it match? Does it not match? So what happens in the meantime? Okay. Do we say that then this shall only cover up to a certain extent? All those things could have been clear, and Parliament would be having those answers. Parliament has absolutely no idea. And that's why Parliament, what happened early last year, they summoned the ministry and SHA to Mombasa. And they were like, watu wanasema hii kitu haifanyi kazi, hebu tuambie wewe CEO hii kitu unafanyaje kazi? And the CEO of SHA was like, this is according sheria gani? You passed the law.
They were being given a lesson on a law that they passed.
Yes. In Mombasa, no less. They spent an entire weekend summoning the ministry and the SHA chair and entire management of SHA then to go and explain to them how they are rolling out SHA. And MPs were sitting there like, lakini hii kitu watu wanasema haifanyi kazi. Lakini hii kitu
as if it bypassed Parliament somehow.
Sasa lakini, we chairman, sasa mimi mtu wangu naweza msaidia apate... Parliament.
Problems begin and end there.
Completely. Completely. And our way forward is on us, like you said. It's on us knowing that if we want a government that works for us, then we've got to put in people who know that what working for us means, who know what public service means. And if they don't know, we shall force them to learn what public service means.
Agreed.
That they shall do everything in the interest of the public, at the very least, especially when it comes to children. That a child cannot walk out of here, go to school and be sent back home without access to free compulsory education as guaranteed in the Constitution because some guy somewhere didn't do their job. That a student cannot go back home not having eaten because some guy somewhere didn't press a button.
Right.
That a patient can't go and lie on the grounds of a health facility not knowing what to do because some guy somewhere just didn't do what they were supposed to do. Not that they didn't know or not that they could not have known. They were just incompetent not to do it. We should not be allowing such kind of nonsense to happen in our society. We're 2 years goodbye.
I'm wondering what the attrition rate for parliamentarians is. Because that to
it's
me...
It's usually over 60%.
Really?
Yes. Every parliament has 60% new guys coming back.
And still... So then how do we hold these people accountable?
We hold ourselves accountable.
How do we hold ourselves accountable?
By asking ourselves, so who are we voting? Who is that we are electing? How are we electing them? How are we holding them accountable? Because like you said, what's the quote again today?
Whether
source of the problem.
I was about to say whether we keep new indecting.
Source of the problem
cannot be the
cannot
fix.
Just be the solution of the problem in the same culture. We can't also continue in the same culture of voting out people and electing people based on their tribe and political patronage. We shouldn't. We cannot solve this thing by saying that we shall remove MP so and so, so and so, so and so, because now they are against the guy that they went in with, and now they are aligned with this guy whom we like.
Yep. That's the ultimate fix. It's us. You know, they do say, genuinely, you're not going to change another person. It is, you can only work on yourself. And then your reactions to said person, your treatment of said person, or said thing. So you're absolutely right. We work on us, our choice of leaders, our accountability with ourselves, and then we'll be able to hold them accountable. I think that's the ultimate fix. I would hope to see a world where every third headline isn't about some failure of some critical institution.
Yeah.
That would be my wish. I don't know how we get there in the shortest amount of time possible if we're not very honest with ourselves as far as our part to play in it. And that's at the ballot and even before the ballot. At party primaries, at barazas when people are calling for either public participation, that's all our part. Even here on Fixing the Nation.
Indeed. Coming up next on NTV, it's Your World with Winnie today. Are wife material and husband material just myths? Are there people who are basically just wife material and husband material? Or is it just kelele town?
Bushika nini? Apo. That's wife material.
Ah, there you go. Sawa basi. Kagondu Jr. is a relationship coach. Grace Mudhoni Dalizu is a marriage counselor. Sheikh Swaleh Mtetu is a religious Muslim leader. And Dr. Geoffrey Wango is a counseling psychologist. Those four will be speaking to Winnie to answer that question. Wife material, husband material, exist or just myth?
This is an interesting question. Watch out wajipange. What material you're made of, cotton, jeans, wife, husband. Kila mtu ajipange.
Identify the material that suits you.
That suits you.
Yeah.
But of course, we'll hand you over to Winnie. Thank you so much for tuning in. On Nation FM, of course, it's Brian Aseli and Claudia Naisabwa. They are on the Vibe Shift. They'll be with you from 10 to 2, so be sure to tune in as well. Tupatane kesho asubuhi, 6 to 10 a.m. for Wednesday, the hump of the week. Let's get over it in style. Kwaherini.